Welcome back to Real Health. We're often unsure of whether the symptoms we are experiencing are those of a cold, a sinus, or even hay fever, and we end up getting the wrong over-the-counter medication. Well, in our Real Health Medicine Cabinet feature, the team came across a homeopathic remedy that helps for all of these types of symptoms. But before we get into the product, let's first understand the symptoms better and shed some light on these conditions is homeopathic Dr. Jacquelyn Schultz. Welcome to Real Health, your first time on set. It's great to have you with us.
Thank you so much.
So this is the tricky part, right? When you have experiencing sinus and hay fever, perhaps because it's change of season, you may also think that you have a cold, it's beginning of the flu, all of these conditions here, you just want relief and help, but we often end up choosing the wrong things, right? Why is that?
I think the fundamental reason is they're all so similar. And you have to understand what each condition is because each condition requires such a specific treatment. So you have to understand that a cold is going to be a viral infection that mainly it results in excessive mucus secretions and a bit of a runny nose, a bit of a cough, definitely boggy mucous membrane, so you get that congested feeling. But because it's viral, it's spread via droplet infection, which means if anyone around you has the virus and they cough and sneeze, and you don't have an immune system that's working at optimum and you breathe it in, it's going to set off the symptoms of a cold. So a cold is definitely a viral infection. It's self-limiting. Within 7 to 14 days, it's come in, it's done its thing, and it's left.
Okay.
Whereas your sinus infection is the spaces that are next to your nose and your forehead. They're there to warm the air and clean the air. What happens is those membranes get inflamed. They make way too much mucus. And as a result of that, you sit with symptoms of facial pain or headache or congestion. But that can be viral. It can even be allergic, and it can definitely be bacterial. And then your hay fever symptoms come from a completely different side of things because now we're looking at allergy. So something in your environment, something that you've been exposed to, possibly even eaten, has resulted in your body releasing too much histamine, and that causes symptoms of itchy eyes and watery eyes and a snotty nose, even a scratchy throat. And the ideal way is obviously to try and avoid the allergen, but it's not so easy if you don't know what it is. So you want to try find something that will treat it without any adverse side effects.
So how do you distinguish between the three?
Well, we know that there are tons of overlapping symptoms. I mean, it almost sounds like I've described the same condition three times. And we know that excessive mucus secretions are, without a doubt, the main symptom that's there. But if you know what the cause of the problem is, that's how you're ultimately going to define what the condition is.
Okay. Or is it also a factor of, I've had this for longer than 2 weeks, or I've had this only in a specific area, place, environment, or time frame, or is that something that could be common to all of them as well?
Yes and no, and you're not wrong, because as we said, the common cold self-limiting. So it's going to come in and your immune system hopefully is going to do its work, and within 7 to 10 days you would be over it. I always say to patients, whenever there's excessive mucus secretions, and
what's excessive? Because some people learn to live with something that's subpar, right? And they say this is normal.
Well, I always tease my patients and I say, understand that a litre of mucus a day is normal for your mucous membranes to produce, because they're the first part of your immune system, so that when you breathe in a germ, those membranes secrete the mucus to engulf the germ. You release enzymes to destroy that germ, and then you either cough it out or you sneeze it out or you swallow it. So if you're producing mucus where you're aware of it, where you're clearing your throat and you're blowing your nose, you've now gone from 1 litre probably to 3 litres, but you didn't realize it. And that is an excessive mucus secretion. We shouldn't be aware of mucus running down the back of our throat. We shouldn't be aware of nasal secretions and blowing our nose, and that it happens, and a lot of people do blow their nose in the morning, but it doesn't continue throughout the day. So I find my allergic patients, the easier way to assess whether this is a viral cold or have we moved into allergy is their mucus doesn't stop. It just continues ongoing. There's no associated symptoms like fever or pain. There's just this constant mucus issue that they're dealing with.
So what type of lifestyle and nutrition changes do you recommend to your patients before trying any remedies or medication or anything like that? What do you get them to change?
Well, from the lifestyle perspective, the overriding theme that I always try encourage my patients is understand that your immune system is everything. It's your internal army that's going to respond to any invading pathogen. So you have to have a lifestyle that's going to promote a healthy immune system. So the good old-fashioned things that our grannies and grandpas told us really stand true. You've got to drink enough water, you've got to eat your veggies, you've got to get enough sleep, and be mindful that absolutely, I'm not saying don't have any alcohol, but moderation, and smoking is going to aggravate all your symptoms. So when you embrace a lifestyle that is mostly healthy, it's going to reflect immediately on your immune system, and you're going to be well. And there are certain foods we know that can possibly make it worse. We know that the casein component of dairy causes a bit of inflammation and maybe make the mucus secretions worse. We know certain patients, if they have citrus fruits and orange juice, they'll say, it made my mucus worse. So we do have to be mindful that certain patients will be sensitive to certain food ingredients, but the most important thing is on a day-to-day basis to look after your immune system.
Funny enough, when people remove gluten, they tend to see a change in sinusitis and hay fever as well.
Absolutely, especially if it's a condition that's chronic. And the reason for that is we're finding, especially in South Africa, the gluten creates a lot of inflammation. We're not quite sure why. We're not quite sure if it's because the crops are sprayed with a whole lot of insecticides and those aren't possibly rinsed before they're milled. But patients in South Africa, when they have gluten, most definitely find it's pro-inflammatory, but they might travel elsewhere in the world and consume gluten and it's fine.
The team tried a homeopathic product called Coryzalia, which works effectively for cold, sinus and hay fever. In fact, we have it in studio with us. It also helps with rhinitis. Tell us what's the difference between cold, sinus, hay fever and rhinitis.
So rhinitis is really just the fancy name for a runny nose.
Okay.
So if you want to sound posh, say I have rhinitis. But rhinitis can also be from an allergy. So we're basically saying again that frustrating term, excessive mucus secretions coming out of your nose. And sometimes when patients don't understand why they've got the extra mucus, that's why we recommend a product like this, because whether it is viral, bacterial or allergy in the cause, the medications that are in that product are going to assist the body's own immune response to deal with it appropriately. And half the trauma in medicating a child is getting the child to take the medication. So one of the reasons that I use this medication often in my practice is that the kids love it because it's a tablet you pop in your mouth and it dissolves like a sweet. So I don't have to threaten their lives to say, listen, if you don't take this medication, you're going to get something far worse.
They actually don't mind.
Compliance is great.
Do you adjust the dose then for children, or is it the same?
It will actually be the same dose.
1 tablet every hour to be slowly dissolved in the mouth mouth outside of meal times. So separate to meal times.
Ideally away from the food, and the only reason for that is homeopathic medication is actually absorbed in the mucosa of the mouth. So if there's food there, it might slightly hamper the absorption, but that's optimal dosing. We certainly will say to a patient, don't worry, rather take it than not take it. And the homeopathic prescribing will always be the worse the symptoms, the more acute the symptoms, the more often you're going to dose yourself. So as you feel better, you reduce how often you're taking the medication.
And this is a month supply, or how many? We've got 40 tablets.
So it won't.
But if you're taking it every hour in an acute situation, you might go through this quite quickly? Or?
Well, you're also going to get better quickly. So you shouldn't need more. So
then you would start
as soon as you have the symptoms, and of course because it's homeopathic medication, there are no adverse side effects nor their contraindications. So even if you suspect, you go, I think I've got a tickle, or you just, everyone knows when they're getting sick.
So it's preventative as well.
You start taking it so that you can optimize the immune system and hopefully completely derail that infection.
Fantastic. So where can we find it?
Pretty much any leading pharmacy, any health shop, and a lot of prescribing practitioners will keep it in the dispensaries as well.
Fantastic. And you've been using it for a number of years, months?
Probably about 8 years.
9 years. Well, it's good. You swear by it. You give it to your kids?
I do. She'll take it.
Well, thank you so much for joining us on Real Health. We look forward to having you back.